Stephen Jjemba, a man with a physical disability, walks down the street. Maria Lukunda, a blind woman, walks toward her house with a man guiding her.
TASO clients, especially those with a disability, most of them are not employed.
Stephen mends another man's shoes.
Keeping clinic visits, call for support in the form of transport. Some people are isolated from the main roads.
Drone shot of a rural village in Uganda.
They need to pay some money so that they can reach the treatment center. Yet these people are not employed. Some of them are living without caretakers. They don't have relatives. TASO as a clinic does not provide transport. We only provide treatment.
View of a busy street through a car's windshield.
So people with a disability find it very challenging to connect from their places of residence to the treatment center. That is TASO.
Patients at a TASO clinic.
That poses a very big challenge.
More patients at TASO clinics.
I
live in Bulai, Masaka City. I became blind in 2015, and I take ARVs that I pick up from TASO. I face challenges when I'm coming from the village, and thus transport is my biggest problem to move to the hospital.
Transport is my biggest challenge because if you don't have money, it's difficult to pick up medicine from the hospital. It's important to get means of transport. That's the biggest challenge, but if you get a person to lend you money, when you get it, you can pay it back.
Stephen sits on the ground, arranging his tools and fixing other people's shoes.
Right now, in my situation, during the pandemic, motorcycles were not allowed to carry passengers. There were police officers who could stop motorcycles from taking me. I could explain to them that I am disabled, but they could not understand. Motorcycles were being stopped from carrying passengers. I could explain to them that I have to get something to eat. If I stay home, I won't be able to eat.
Yellow words on a black screen say, Stephen is a cobbler who makes less than $2 to $3 US a day.
Still, some could try to stop me, but still I found some that were genuine and could understand.
Stephen sharpens his tools.
One day I was tempted to go to the district residence commissioner. When I reached there, he said, unless someone does not understand, but your situation is self-explanatory, he assured me that I should continue using motorcycles. In case you get arrested, refer back to me.
Stephen pounds something with a small hammer.
He could understand, but I kindly request the government to sensitize its workers about the requirements of people with special needs, as our disability is visible.
People waiting in a TASO clinic and filling out paperwork.
We make follow-ups. We term that on as home care, where we visit patients with special needs at their homes. And the major purpose of doing this, one, is to give them home-based treatment. We can choose to treat them from home. Secondly, to assess the home environment. We are looking at hygiene, who is providing the basic needs. Yes, we look at the community support.
Maria walks up a hill with a man holding her arm.
First of all, we give them empowerment counseling. We make them realize the opportunities around them. We make them to realize the resources that they may take to their advantage.
A doctor treats a patient at a TASO clinic.
We provide them with adherence counseling concerned with how best can you take the treatment and how can this treatment be of help to you.
A woman holds a book showing how a patient should take their antiretroviral drugs and when to report back for a checkup.
We go ahead to provide family counseling. Because we have had cases of discrimination, family members can choose to neglect that person. So there, TASO intervenes and talk to the family members, making them realize the value, the worth of this person living with HIV and disability.
2 women on a bench talking outside a TASO clinic.
Instances where people with disability have been abandoned, we talk to the family members and we see how we can reunite them. So that kind of family counseling to the families where we have a person on treatment and this person is living with HIV is very much emphasized, that family counseling.
Edward Muwanga, a manager at TASO, sits at his desk.
We provide HIV preventive counseling to the people with disability so that they don't get HIV.
A client holds ARV drugs.
Because a person living with a disability has the right to enjoy the sexual rights, have sexual partners, you know.
Patients and doctors interact at a TASO clinic.
First of all, most especially those people in the government positions, they have to consider that people with disabilities are like other people. Because in case someone goes to the hospital and explains to the officials that I have a disability, I kindly request that they should allow me to use the motorcycle, to receive my medication.
A dusty road from the view of someone on a motorcycle.
And I leave as early as I can to do other things. As it's not allowed and yet you have requested them and he can visibly see it. As our disability can't be hidden, but you request them and they instantly refuse, but honestly can see it.
Once a person living with HIV and the person is having disability, once confirmed HIV positive, it is important that you accept the serious status. I am HIV positive. Yes, you accept and look at the way forward. Because after accepting, you can make good treatment plan. But if you deny the test results, you cannot come up and make good treatment plan.
A person counts tablets, which are distributed to patients.
And work with the support team. Work with a team of counselors. Work with a team of peer educators. Make a plan for the positive living. How do I live with HIV and disability? Of course, life will go on as somebody is on treatment.
Yellow words on a black screen say, "It's important to note that we are all potential victims of disabilities through diseases like HIV, accidents, wars, and natural calamities. Creating an inclusive environment for people with disabilities makes accessibility easier for other people and prepares for those incoming uncertainties. Let us work on not leaving anyone behind."